That's so weird. I just was walking in and I said, it feels like snow.
It was incredible. It was beautiful.
Yeah.
I was walking over from Main Street. It was really dramatic.
Um, we have about a few seconds.
Okay. Yeah, great. I've got to go north. I'm going up to Littleton. Good for me.
Got like 20 seconds. I'll wait till one.
I know. I drive it all the time.
Right? Good afternoon, everyone, and Happy New Year. Welcome to Senate Transportation. And would you please join us in the Pledge of Allegiance? And Senator Ward, would you take the charge?
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you. We are going to start by opening our hearing on Senate Bill 467. Welcome, Senator Prentice.
Well, thank you very much. Good afternoon. Yep, here we are, 2024. This is my first bill that I'm introducing, and I couldn't be more proud of the group that we have here, and I'm honored to introduce legislation that is going to work to improve or really drive down the impact of injury in this state, the burden of injury. So with that, Honorable Chair, members of Senate Transportation, for the record, my name is Sue Prentice. I'm a state senator from District 5, so I live in West Lebanon, but I represent 15 communities, which is most of Grafton, a large piece of Grafton County, a few communities in Sullivan County, and one in Merrimack, which is New London. So I always thought that was pretty interesting. I am here today, and this is again my first bill, to introduce to you Senate Bill 467, which would authorize the Department of Motor Vehicles to issue injury prevention number plates and establishes an injury prevention number plate trust fund. By the way of background, I'm a paramedic and I've worked in the development and implementation of trauma systems, including in the state of New Hampshire, since 1999. These are systems of care that take into account a continuum, a whole made up of many parts. The part we are here to discuss today is the prevalence in New Hampshire of injury and how we can build efforts to prevent injury, therefore save lives, improve the lives of those who survive, and save costs to both persons and to society. But before I start, I briefly want to take this time to honor the work of a former colleague and a friend of mine who passed away this fall by the name of Elaine Frank. And many of the people that are here know Elaine. Elaine was she was the director of the Injury Prevention Center at Dartmouth. I mean, I first met her in 1992. We shared an office at the medical school, and she was running the Injury Prevention Center then and through till she retired close to 10 years ago, and we managed to keep in touch, but sadly, she passed away. She made friends everywhere and knew how to translate the burden of injury and bring. One of the things she was so incredibly skillful at was bringing like collaboratives or cooperative groups of people together to address a problem related to injury, and could get people who had diverse opinions to agree on what they had in common and then find ways to fund or move projects forward. She was a loving, compassionate, and dedicated public health professional. And so in introducing this, I want to introduce this bill in her honor and her memory, because she's just, I'll never forget Elaine.
Sorry for such a great loss.
Thank you. So I modeled this legislation, after the conservation plate and their trust fund, which was a great pathway to follow. And it also points out that we've done this work before. The issuing of these plates and the proposed revenue gathered would benefit injury prevention programs statewide, ultimately through our Injury Prevention Center. And we have representatives from the Injury Prevention Center that's at Dartmouth here today. This would allow a more dedicated source of dollars to build out current and future efforts to prevent what is killing and disabling many Granite Staters. And quoting our 5-year injury prevention plan, and I think this 5-year plan is done in 2025, injuries, whether intentional or unintentional, make substantial physical, emotional, and economic impacts on society that can have lasting consequences. In 2018, there were 1,277 injury-related deaths in New Hampshire, affecting families, schools, workplaces, and communities. These fatal injuries cost over $1 billion in a lifetime of medical expenses and work loss, which translates into $771 per capita in the state of New Hampshire. There's some data that I'm going to cite today, and others will provide data, but mine is rooted in the Centers for Disease Control Whiskers database. So that brings data in from all of the states, and it usually runs a little bit behind by a few years. So I'm working mostly with 2020 data. So I do want to share that injury in the state, age adjusted, or no, death in this state, age adjusted, between 1 and 44, the leading cause is trauma. And that is greater than cancer, heart disease, and AIDS, and often combined occupies more hospital beds per day. So it has a great impact. And we don't often think about this because it is so episodic in nature. But if we look at really our youth and folks who are typically out in the workforce, they're the ones largely in their families being impacted by injury. So prevalence of death and disability, age adjusted 1 through 44. We also have a group that is outside of 44, and actually, in my age group, I'm 59 now, I'll be completely transparent about that, that sustain falls. So when we start to look at the mechanisms behind death and disability, when we're talking about death, it's going to be motor vehicle crashes, okay? And second would be falls. When we start to talk about disability, it's falls and it's, our older population. But it is 1 in 44, most productive time in the workforce being impacted, by injury. So just mentioning that, and also from the CDC, fatal cost in 2020, fatal injury cost, $9.98 billion. Years of potential life loss before age 65, 98,447. And it does break it down. You can go by age adjusted and look at poisoning, falls, suicide by firearm, unintentional motor vehicle traffic, and then lastly, but still sadly, is suicide by suffocation. Injury remains, again, the leading cause between 1 and 44. It occupies high rates of hospitalization in beds, more often than cancer, heart disease, and AIDS combined. The cost to the individual and their family, which I've already mentioned, and back to society can be staggering, yet this is all, well, not all, but largely preventable, and I'd like to think all. I want to reflect back on a time when I was younger, and some of you might think about when, remember times when there used to be a lot of building fires. And we don't have as many fires now. And we still need fire departments. And a lot of them, they do incredible work. And one of the things that they started doing was fire prevention. And they started looking at different ways that they could teach the community about how to prevent fires in their homes and in their workplace, as well as looking at how buildings were constructed and materials. And my point is that, there's been significant efforts in fire prevention, which have driven the number of these large and really even residential fires down in different parts of our country, including in New Hampshire. So that's great work. But there still will be people that get hurt, and we want to minimize that, and especially want to keep them from losing their lives and becoming disabled so that they can't live the life that they had prior to their injury. And as I said, this goes back for me to 1999. And I've been thinking about this for years, knowing what the burden of injury is, and that it's not often talked about. I feel like I have this conversation over and over, but every time it's new because again, it's episodic, and we don't think about, I think, injury as much as we might think about some other medical conditions and diseases and their impact on folks' lives, because we might know more of them. But injury is like this unknown story that has we can prevent the outcomes if we can further engage the programs that we have. So this proposal in 467 brings forward a new, it's new, but it's not new to injury, source of funding by choice for our granted staters. This allows an individual to choose to support prevention, to save lives, and improve the lives of those injured with this investment. I have with me today, folks, I'll try to answer any questions. I've already am thinking about an amendment that I'd like to make to the bill. I'm very interested in the committee's feedback. But I do have with me here today representatives from the Department of Health and Human Services that can talk about the existing structure, because they do have an injury prevention program, and their relationship with the Injury Prevention Center for New Hampshire, which is based in my home city of Lebanon. I have representatives from the Injury Prevention Center that are here to talk about their current programs and their impacts statewide, and especially if they were able to increase, bring more funding in, what they could do. I do also have with me, and there's maybe others, and it's great, Dr. Patterson. I first met Dr. Patterson when I worked at Concord Hospital in their emergency department, and she has served as the head of their trauma program, and is, as I understand it, is semi-retired, but has been in this building dedicated to talking about injury and the prevention as long as I've known her. And we also have representatives from the Department of Motor Vehicles that can talk about the work that they already do that's related to this and how it could impact their department. And what I know, and what I've known for years, is that we can make a difference in the lives and saving the lives of so many by reducing associated costs, by preventing lost time in the workforce and with families, and so much more. I think this story is largely unknown in parts of New Hampshire, and even you all have gotten to know me, so you've heard me talk about it. But again, I feel like it's a new conversation every time, and we have a practical way to bring some dedicated funds by choice to injury prevention work in the state. So with that, I will conclude my testimony. I'm happy to take questions. If I don't have the answers, I'll get back to you. What I am thinking about amending, Senator Shardy and committee members, is where it talks about the 3 different departments where the funds would go to. In consultation with some of the stakeholders, we might look at just moving it through DHS to the Injury Prevention Center, but I do want to talk to safety about that. They're all combined in doing this work together, but really where the money needs to go is to the place where we can deliver the programs statewide. So that is something that I'm thinking about, and I'm going to get back to you on. Okay. That's
Are there any questions from the members of the committee?
No, go ahead, Ruth.
Senator Ward?
Thank you, Madam Chair. Thank you for taking my question. This bill raises money to support a program of injury prevention. What do you do to prevent injuries? That's what I'm curious about.
Well, so I have the folks from the Injury Prevention Center at Dartmouth with me here today, and they'll talk about some of the programs. But there are programs that have to do with suicide prevention, with firearm injury prevention, with child passenger safety. There are dollars that already come in that are more heavily dedicated to suicide and on the violent side and motor vehicles, but there are offshoots of these different programs that we could invest in. I'd love to have the Injury Prevention Center more directly and answer that question for you.
You follow up?
Yes, please.
Thank you. Because all of it, I'm thinking about bad injuries in the motor vehicle, in crashes and those kinds of things, and what is done to prevent those kinds of things. I mean, educational programs?
Educational programs. Okay, thank you, Senator Ward, for your question. Educational programs that work against, say, distracted driving. Certainly, we are always working in not just the distracted driving arena, but in dealing with seatbelt safety and getting especially our youth when they're learning, from a driver operator perspective, to be wearing their seatbelt. So those are at least 2 of the programs.
Okay, thank you.
You're welcome.
Senator Waters?
Thank you, Madam Chair, and thank you, colleague. Let me just say at the start that, we're not the Health and Human Services Committee. So injury prevention, all that, it's all good, but we're not that committee. We're transportation. And so I do have some questions particularly about why this approach in the bill. We stopped doing specialty plates pretty much completely a number of years ago because of the cost involved, but more particularly because of the number of people who wanted to do things. We went to the decal system, and the decal program lets you raise money for an organization, and as long as it's a 501c3 and the organization can distribute the money however it wants. But the decal is very, very efficient to administer. It's cheap to do. And, I see in here the fiscal note that they're going to have to do 4,800 plates even to break even for the one-time costs. And I don't think you're going to sell 4,800 plates on this thing. Maybe you will, but, you look at a lot of other the decal program, other things, you don't see that much, but did you think about a decal?
I did think about a decal program, and I did choose this vehicle for two reasons. Well, actually, and first, the idea I have to, in complete transparency, it was a pediatrician who had taken care of my daughter over the years, who had spoken to a friend, a colleague of mine at Dartmouth Health about being in Maine and driving through Maine and seeing the Barbara Bush Children's Hospital, which does, have a relationship to injury prevention in Maine. So this came to my attention, and like the very next week, I went to my sister's house in Portland, and I saw that license plate. And I was like, oh, okay. Well, if we had a license plate like that, how, what could we do with the funding? And really what we could do with it was dedicate it to a place where we have federal funding, but we don't have, I think we only have 25% matching funds on for the Highway Safety Office. But my point is, we don't have a lot of dedicated New Hampshire dollars. So I thought about that. And then I also, honestly, two other things I said two, but I'm going to say three. I looked at the Moose plate and how it broke the revenue down and what it was able to do over time in terms of generating funds, which it's been in place since I think it was the early 2000s. It's significant over time. So that was, certainly it is, I think you always have to shoot for the moon and then look for where the in-between will be. And then I've had experience, we passed a decal plate here for emergency medical services. And that we've had difficulty in getting that set up, and not for lack of trying to get it set up, but it's more on the side of the not-for-profit that's administering it. Now, Dartmouth has the Injury Prevention Center has a much more robust structure than the folks that are running this on the EMS side, but we're still like going through it. So I'm like, okay, we've got a model that's worked. Over time, it's generated, reasonable, decent revenue, and I decided that I wanted to try to take that approach. That's why.
Thank you.
You're welcome.
Any other questions from the committee? Seeing none, thank you, Senator Prentice.
Thank you.
The chair will now call. I hope it's Janice. I can't really make out the name. Eslon, E-S-L-O-N. Jonas? I'm trying to make out the writing.
Siegel.
Oh, no,
yeah.
that one's not
Oh, that's-
speaking.
that's,
Yeah. Can't make that out. Janice? Jonas?
Dartmouth Health.
Dartmouth Health, is
James.
that out?
James.
Oh, James. Okay. Okay, I just can't make.
Two pairs of glasses will get us there.
Am I right? So I'm like, okay, until you said Dartmouth Health, all right.
I am the first to admit I have the world's worst handwriting.
I know, we keep trying to encourage
see
people to
mine.
really print so we can see it, but that's okay. Welcome. Thank you.
And our director, Angie Leduc, will be opening up for
I'm
us.
just gonna let
Okay.
them get there.
For the record, just state your name and then you can begin your testimonies.
Thank you, Madam Chair, members of the Transportation Committee. My name is Angie Leduc. I'm the manager of the Injury Prevention Center at Dartmouth Health.
And I'm Jim Edston. I work as a program coordinator for the Injury Prevention Center.
So we are here to support SB 467, which relative to the establishment of the Injury Prevention Number Plates Trust Fund. We have written testimony, which was just passed out, which includes a link to our website, which allows some description to our various programs that the Injury Prevention Center offers. We really wanted to appear in person today to provide just a brief overview of the current state funding and what we do with that current state funding and the impact that it has had so far, and what we could do if additional funds were generated under this proposal and how it might help. So as you heard from Senator Prentice today, injury plays a significant role in the lives of New Hampshire residents. And in fact, unintentional injury since 2016 is the third leading cause of death for all ages in New Hampshire. So unintentional injury includes the top 4 areas for New Hampshire residents are falls, poisoning, motor vehicle crashes, and drowning. Our current funding is through the New Hampshire Office of Highway Safety, which funds our youth operator program and our child passenger safety program, and that includes full and partial state funding for for staff, and it is statewide. So these programs are throughout the entire state, and through the New Hampshire Department of Health and Human Services Injury Prevention Program, which offers various streams of funding to fund programs in falls prevention, poisoning prevention, drowning prevention, and which we're going to talk more about these programs independently, as well as suicide prevention, some efforts there, and stop the bleed trainings. In addition to the efforts that we deploy across the state in collaboration with many injury prevention partners, we also receive Dartmouth Health Children's philanthropy funding, which includes providing provider education and safety product and gear through our pediatric clinics throughout our health system, but also is open to any providers and patients and families throughout the entire Dartmouth Health system. As you can see in your written testimony, I provided just some highlights of what the state funding has allowed us to do just since 2022. We've provided over 100 New Hampshire communities, almost 7,000 helmets and bike and pedestrian safety information. And these communities hold events such as bike rodeos and really involve the entire community in this type of education. Jim leads us in many of these programs, and he has held every year for 20 years, I think, the Safe Kids 301 event at the New Hampshire Motor Speedway, which brings in several hundred folks each year. In the last couple of years, since recovering from the pandemic, we've seen about 400 participants at 2 different events, which includes about 300 children. And it allows us to provide helmets to those in need, and also do helmet fittings, and do we did about 50 bike safety checks. A new program of ours, thanks to the New Hampshire Department of Health and Human Services funding, has allowed us to support life jacket loaner stations for over 20 communities in New Hampshire in the past couple of years. And that includes outfitting those life jacket loaner stations with life jackets, and also keeping technical assistance and education as needed. And Jim leads, along with our trauma program, Stop the Bleed trainings throughout the state, and with other trauma program partners in the state. And our youth operator program is quite robust and comprehensive, and it has engaged 20 New Hampshire high schools in interactive education. So when Senator Prentice was talking about distracted driving, these interactive education programs talk about distracted driving and impaired driving, and educate our young people around the harms of these things and the risks, but also talks not just about driver safety, it talks about passenger safety too, and what it means to be safe in a vehicle and a car. And our long-standing child passenger safety program continues to increase our child passenger safety technicians throughout the state. We're almost at 250 technicians, and our fitting stations to about 62. So this is not an exhaustive list of our impact, but are just several highlights that we thought you might be interested in. And any additional funding would help us to sustain these efforts, but also grow and expand these current efforts into additional New Hampshire communities, and really allow us to be responsive and prepared for any emerging injury needs that might arise. And we also have a goal to innovate our educational programs, including videos and YouTube channels and things like that, to increase access to all New Hampshire communities, our injury prevention education. So we really thank you for considering this proposal, and Jim and I would be happy to answer any questions you might have.
Any questions from the members? Seeing none, thank you for your testimony.
Thank you so much.
The chair will now call Lisa Patterson. Good afternoon and welcome.
Thank you very much for having me. I'm Dr. Lisa Patterson. I'm the general surgeon and the trauma medical director at Concord Hospital. And I just wanted to reiterate what Senator Prentice mentioned, was that the trauma and injuries related to blunt or penetrating trauma is such a major impact that really nationwide we call it the silent epidemic. It's very far reaching. It outnumbers cancer and everything by a long shot, but the public just is not aware of it. We work collaboratively in the state. Unfortunately, I was the only one that had the time that could make it to this meeting, but trust me, my colleagues across the state are very much interested in this as well. Even though the Injury Prevention Center is located at Dartmouth, we are such a small state and we collaborate. We collaborate at state meetings, educational stuff, and I just can't say enough about that. Going into your question about educational stuff, I think one of the biggest things is falls prevention. I will also state my age of 63. I'm the tail end of the baby boomers, and the number of falls leading to serious and lethal injuries in the country is going up and up and up, and it will continue to do so for the next 2 decades because of the baby boomers getting up there. That's absolutely a preventable type of injury. Once somebody who's elderly gets injured like that, then their lifespan has significantly decreased. Very small percentage of them actually make it back to their home to live independently. A lot of them end up in a nursing home like my father and dead within a year after having a serious injury. So there is significant means to prevent this type of injury. The other thing is at Concord Hospital, we have seen an unprecedented number of admissions for traumatic injury just in this last year. I asked my nurse manager, and we admitted over 1,300 patients. Never have seen that number of volume here in Concord. That's not counting the people that died. Those are just the ones that injured. And people don't realize the physical and the psychological long-term impacts of having injury. They think, oh, I get a broken leg and be done and back to work in a week. And it just doesn't work like that, especially when you're talking about traumatic brain injury in somebody young. That will impact their life forever. They may not be able to live independently or work in the field that they once desired. So I don't know what else I can say, but I'd be happy to answer any questions. Needless to say, I've been very passionate about trauma care, and I've been employed in such for 30 plus years.
Any questions?
I have a question, but I don't know.
If I can't answer it, I'm sure somebody behind me can.
Okay, I'm just thinking, who determines who's eligible for the injury? Is it a compensation, or?
You mean in terms of the
So
program?
yeah, the preventative I get, but it's also injury. So are you saying that this program will help those that are injured?
Well, the idea is to prevent the injuries, to keep them from coming in to see me.
Okay.
But sometimes that's, patients who's had family members that are injured sometimes see the impact, and that may affect their behavior.
Okay.
So I don't know if you want to speak more to that?
Yeah.
So it doesn't, thanks again for the record, Superintendent. It doesn't provide any type of compensation. This would be to prevent, focusing on prevention. But what Dr. Patterson spoke to and I spoke to as well is that when you bring disability, when you think not just about death, but when you think about the long-term impact on a survivor who might not be able to be, say, out in the workforce, connecting with their family, all the things that they were doing prior to that in the same way, if we can prevent the injury from happening, then we can prevent them from becoming a survivor and their family and them having to go through the social and emotional toll.
So the bulk of this then is education. All right, thank you.
I have just one question. Is it possible for you to send over, via email, so I could see some of your programs that are preventative for it? I'd be interested in seeing how you're helping people prevent falls, for instance.
That all comes out of the Injury Prevention Center.
Okay, I would really appreciate if you could do that.
I think that there's it's on the back center, Rishardi. I think that they put some of them, but we can,
Yeah, so our website is under revision, so it's not, again, updated as it needs to be, so I can certainly provide brief descriptions of all of the different programs and the partners that we work with, and have the types of prevention education, and also safety product in gear. So what prevention does is we do a public health approach, so we're looking at universal strategies where we are trying to get to the most people. So prevention education is one of those ways, and information. But another way is to put a barrier between the person and injury, such as life jackets, seatbelts, helmets, etc. So in addition to the education, there's also that safety product. And so those are two of the major strategies that we do, but we also do additional things that I can write and describe.
Okay, thank you. Any other questions? Seeing none, thank you for the testimony. The chair will now call Kathleen from DMV. How are you?
Madam Chair, Madam Chair and Board, I'm fine, thank you. How are you?
Good.
So I'm here just to tell you about our process if this were to pass. So we have a process where we have to have the sheeting for the plates made. We'd have to have a design, the sheeting for the plates. Then we'd reach out to our DOIT department, who then would program it into our MAP system. That's our motor vehicle system. They would also send it to the vendors who help the town and city clerks process theirs, because there are 3 different vendors that are able to process motor vehicle transactions. So they'd have to send out the XML, their techie talk things, and we'd have to test all that. So they'd have to test their software, our software, to make sure the funds are going to the correct place, that the town and city clerks are able to process these transactions with the new plate types, and that everything goes through smooth. That process would take us roughly about 4 months to do. Then we'd have to test it out on our end and double check everything. We'd check with our audit department to make sure that that's all set, and then our business office to make sure the funds are in the correct place.
Any questions?
Yeah, this is kind of repeating my earlier question. You know, we moved pretty decisively away from specialized plates, but because the process for decals is simpler for you, isn't it?
Yes, it is.
Yeah, thank you.
You're very welcome. Thank you, Senator.
Any other questions? Seeing none, thank you.
All right, thank you very much. Have a great day.
You too. Director Marasco, welcome.
Good afternoon. Happy New Year. John Marasco, Director of the DMV. Happy New Year, sir. Kathy just covered it beautifully. I just wanted to mention that I've had several conversations with Senator Prentice and appreciate what she's trying to do here. As a captain with the state police overseeing the Office of Highway Safety back in 2017, I did work with the Injury Prevention Center at Dartmouth, and they do wonderful work up there. So I think what the senator is trying to do here from the educational standpoint to raise funds and awareness, certainly we support that. Whether it ends up being this bill or through a decal plate, you know, you get the message out there. So just wanted to put that on the record, and Kathy explained the process. There are several stakeholders that are involved and some costs that are associated with it as well. But whatever the decision is, whether it's this type or a decal plate, we will find a way to implement. So
Thank you.
I'll take any questions.
It's hard to speculate, and they're also different in conservation. The moose plate is so different from everything else, and the parks plate are different from everything else. Would you want to even guess about how many people might buy this plate?
I wouldn't know. I wouldn't know, Senator. It depends. This would be more for Senator Prentice, I think. But as far as what her plan would be from the marketing standpoint to roll it out and get people that would want a plate like this and support the cause. On the moose plates, do we know, Kath?
I don't have it off the top of my head.
Okay. Do we think it's probably more than 20,000? Yeah. So I mean, the moose plate, you know, percentage wise is popular, it sounds like. But as far as this particular one, I don't know.
Yeah, thank you.
Thank you, sir.
Any other questions? Senator Prentice, could I ask a question of you?
Chairs. I think we need to invest in a plate to buy some new chairs for the LOB. Okay.
That's injury prevention right there.
That's right, because if this chair breaks and I fall,
It's interesting.
because I'm on that end of the spectrum where a fall could land me someplace.
So my question is, I can see how rewarding and how important this type of program would be. If the plates are just too cost, you know, it's not sustainable and the cost is not manageable or too much, would you consider, in order for this program to go forward, the decals?
I would.
Okay.
As I had stated, I appreciate Senator Waters' question, but I went here knowing that I'd have the opportunity for decals may come up, and I would joyfully participate in bringing that forward.
Okay, thank you.
You're welcome.
Anyone else?
I think you have one more testify. Do you have Abby Rogers?
We're all for
I
injury
know, but
prevention.
she
We're
wants
all
to come
for it.
forward.
Okay.
I know, I mean, we passed Stop the Bleed, and that's another example.
There's no one else on the list, but I always ask if there's anyone else from the public that would like to come testify to please come forward.
I just see them in the back of the room.
Okay. Unless they sign the wrong sheet or something, but on this sheet. Yeah. So just, hi Abby, how are you?
Hi, how are you?
Good.
I may have signed the wrong sheet. Rhonda Siegel from DHHS is here to testify in the bill.
Oh, that's here, but she didn't check she wanted to speak.
Oh, I'm sorry, I put just providing information only.
Right. Usually if you don't check to speak, it means you'll be
sorry
here
about
if,
that. That's my
you'll be
mistake.
here if we need information. Okay. It's okay. It's all good.
They don't let me out unless I speak. So, hi, good afternoon. I'm Rhonda Siegel. I'm the administrator for the Maternal and Child Health section within the Division of Public Health Services at Health and Human Services. Within that sits the Injury Prevention Program. So I'm here as the administrator, as a section chief, but I'm going into my 27th year at the state and close to 40 years in public health. And half of that has been in injury prevention. So the colleagues behind me are well known, and I think I have a lot to say. I'm here today to provide information just related to SB 467 FN relative to the establishment of the Injury Prevention Plates Number Trust Fund. So as you heard, unintentional injury such as trauma from car crashes or unintentional overdose is a leading cause of death for New Hampshire residents 1 to 44. And my section at Health and Human Services has oversight over some of the fatality review committees. So as I speak, we're preparing our child fatality review committee annual report and our maternal mortality committee annual report to the Legislative Health and Human Services Oversight Committee. And those reports will tell you that the number one cause of death for both those, for children and for women who are pregnant or 1 year past pregnancy, are injuries. And that includes unintentional overdoses related to substance misuse. So, an individual's injury risk is in proportion to their level of cognitive, physical, and social development, which is why kids, pregnant women, and older adults have a greater risk of injury, either death or disability. The Division of Public Health Services Injury Prevention Program works with community partners, including the Dartmouth Health's Injury Prevention Center, to reduce these preventable deaths and disabilities. And as you can see, we also have an injury statewide plan, which includes a lot of different partners and a lot of different topics. And motor vehicles are always a topic at particularly child fatality review committee. So even though we're Health and Human Services, it's a public health issue as well. And our partners are, DMV, Department of Safety, the Injury Prevention Center. So current support for the Division of Public Health Services for our contract with the Injury Prevention Center at Dartmouth comes primarily from the Federal Health Resources and Services Administration Maternal and Child Health, or Title V block grant from HRSA. And that enables us a lot of leeway to look at the issues related to maternal and child health in the state and fund priorities, address priorities related to that. And injuries, unintentional injuries, always come up as one of the leading things that we need to prioritize for the maternal and child health block grant, for the Title V block grant. So in addition to the other things I'm the Title V director for the state of New Hampshire, which is maternal and child health. There's also funding from the Centers for Disease Control and Prevention, Preventative Health and Health Services block grant. A lot of the injury funding to the state, which we get, you know, we get I don't know if I'd call it a lot. We get a moderate amount, is segmented. So from for particular injuries. So the National Highway Transportation Safety Association, it's gives money to, you know, the Department of Safety, DMV, Office of Highway Safety. You know, we get money from SAMHSA for suicide prevention, get money for overdose prevention, but there isn't very much money for core injury, like, you know, the work that the Injury Prevention Center does. One of the things they do under our contract is they facilitate an injury prevention advisory committee, which looks at across the spectrum, you know, what injury is doing, you know, how is it impacting the state, and what are the best initiatives to focus on and fund according to, you know, according to the data that we get from, you know, from either safety, you know, the data that we steward, like hospital discharge data, et cetera. You know, our youth risk behavior, IRBS tells us a lot, so does the behavioral risk factor surveillance system. So, so they facilitate this committee that's comprehensive and multidisciplinary looking at it. Again, though, we have a very small piece of funding, and so this funding would enable to us to expand our contract and expand the services. Contractual activities to support the program and the Injury Prevention Center follow our New Hampshire Violence and Injury Prevention State Plan 2020 to 2025. The Injury Prevention Center is currently updating that, and if enacted, these funds would enable the Injury Prevention Program and the Injury Prevention Center, or through the Injury Prevention Center, to increase its capacity in implementing community-based interventions. Thank you, and I'm happy to answer any questions that you may have.
Questions from the committee members? Seeing none, thank you very much.
Thank you.
Are there any other members of the public that would like to speak to Senate Bill 467? Seeing none, we will close the hearing for Senate Bill 467, and we will open the hearing for Senate Bill 428.
You're up, Madam Chair.
Okay, look at that. Hold the phone here. All right.
Oh, you got two, you're
Well,
busy today.
I know. I don't know what it is, right? Yes. What I'll do is I'll let you change it. I'll sit and say that.
Oh, thank you, sir.
Oh, this is an injury here. I know. Good afternoon. For the record, I'm Denise Ricciardi, State Senator for District 9, which is the town I live in of Bedford and 12 other towns. I want to announce first that this hearing was set and the constituents that asked me to put this bill forward are sick. So after any testimony has been heard from others, I'd like to recess it for a hearing for another date. So I do come before you in strong support of Senate Bill 428 FN, an act that will improve the use of automated license plate readers, LPRs, for our law enforcement community. It will also make an appropriation to the Department of Safety for digital automatic programming interface to connect data from the Division of Motor Vehicles to the state police. I was asked to introduce this bill from a constituent and a former representative, Ken Peterson. When this law was passed in 2016, lawmakers were under the impression that if the law was passed, the funding to connect the data from the Division of Motor Vehicles to the Division of State Police and municipal law enforcement agencies would then be funded by the Department of Safety. Unfortunately, that has not happened, and the LPR system cannot work without this data nexus. This bill that is before you now will provide for this funding to connect the systems together and also to purchase 250 LPRs for the existing state police fleet of cruisers. No state funding is proposed to purchase any LPRs for the New Hampshire towns and cities. They will be required to fund their own LPR purchases. Furthermore, this bill redefines serious crimes. And I wanted to also add that this is about saving lives, amber alerts, silver alerts, and serious violent crimes. There was a couple in the Bedford that have dementia, and they were found because of these LP readers in New York where they have them. So I also want to mention that this bill proposes to expand to 180 days the time this data is stored before it must be mandatorily destroyed and not recoverable. This expansion is vital to law enforcement to make the information useful. The current requirement that is records of numbers of plates read by each LPR shall be purged from the system within 3 minutes unless certain circumstances are met. This is a huge safety issue, and I thank you for your consideration. Any questions?
Any questions from the committee?
Okay.
Madam Chair, nobody signed up, so we'll just recess the hearing.
Yes, and
Okay.
we'll continue when we have the people who can testify.
Unless there's someone who didn't sign up would like to speak, I will recess the hearing. And you're up again.
Oh, I don't have.
Seabury Lane.
Thank you, Senator
I'll open
Waters.
the hearing on Senate Bill 429.
Senator, can you
Well,
turn your mic on?
welcome the prime sponsor.
Thank you again. For the record, Denise Rishardi, State Senator, District 9, contains 13 towns in my district. Long before my time in the legislature, my neighborhood on Teaberry Lane in Bedford has had an ongoing huge noise barrier problem. They bought their homes, most of them in the 1960s, which abut the now highway. And as the highway has grown, the noise has gotten worse. And no one can deny that they qualify under the decibel. I've been in their homes standing outside of the driveway, and Commissioner Cass has been gracious enough to go several times, and nobody denies how incredibly loud it is. They can't open their windows. They can't sleep. They can't entertain. They have random people off the highway coming to their homes, stealing gas cans. And the unfortunate thing is that the way our policy is in the Department of Transportation is that although they qualify for the noise barrier with the decibel, it's about density. So, for example, if it wasn't just this neighborhood of people, but an apartment, the apartment building would qualify for the noise barriers, which I kind of find unfair since these are people, homeowners. All that being said, this has been going on for at least 12 years back and forth in the legislature, like I said, before my time. Once I came on board with this, we've had several meetings with the neighborhood and Commissioner Cass, their engineers, and we tried to find a compromise for the neighborhood. And there was a stockyard fence there, but it doesn't do anything, and then it fell over and rotted. So after these multiple meetings with the neighborhood and the Department of Transportation, a compromise that the neighborhood, we came to a conclusion they could live with. It's not as good as the noise barriers, but it's something that they could work with. Unfortunately, the work was supposed to begin in the fall, and that hasn't happened, which I'm sure Commissioner Cass will speak to the reasons why. So there's been talk that it possibly will be the spring. But, you know, because it keeps getting pushed back and this has been going on for 12 years, I wanted to bring a bill forward that gives them these noise barriers because right now, on paper, maybe things are being done, but nothing really has gotten done. And these are a neighborhood in my district. These are my constituents. And I believe your home is your castle. And no one should have to live with that kind of noise. I mean, one of the poor neighbors, literally, people used his driveway as a park and ride. He couldn't even get out of his garage. I mean, it's really bad. So that concludes my testimony on this. If you have any questions for me, I'm happy to answer them.
Does committee have any questions?
Okay,
Thank you, Madam Chair. And the only person signed up is Commissioner Cass.
Good afternoon, Senators. I'm William Cass, Commissioner for the New Hampshire Department of Transportation. Senator Acciardi, I think, did a good job summarizing the issue, so I won't go into a lot. With me here is John Evans, who's the department's noise specialist. He can answer any questions about the policy and how we evaluate things, but I signed up in opposition to the bill primarily because, you know, we have studied this area before. It is contrary to our noise policy, which we try to diligently apply consistently because there are a number of other neighborhoods along the Effie Everett Turnpike, around other highways in the state that are unfortunately in the same situation as T-Berry Lane, where we certainly admit that the highway noise exceeds the established thresholds, but the cost of building a sound wall does exceed the cost effectiveness criteria that we've established in our policy. So that is, and like I said, there are many places across the state that are in similar situations. So we try to be very diligent in applying the policy consistently. I can speak. So we're here to answer questions if there are more details about the policy and stuff. I won't, in the interest of brevity, we won't launch into that. But as an update for what we are looking at doing with the T-Berry Lane neighborhood, we did meet out there last summer with a compromise situation. People asked, well, can't we build a berm or something like that? Historically, in response to these questions, we said we can't build a sound wall. It doesn't meet the criteria, but we can try to put up a privacy fence and put up some fencing to at least try to address the concerns about encroachment for the highway and people getting into their backyards. There was a stockade fence there. It was it did rot. It did fall over. It did get into disrepair. And as part of the compromise that we've trying to work through is looking at building a berm adjacent to the roadway slope. And installing a stockade fence on steel posts, so it'll be a much more durable fence. It won't necessarily have noise mitigation attributes. It won't necessarily be effective from a noise reduction, but it will be a visual barrier and will provide some of the separation from the highway from the neighborhood. Part of the delay that we got into in working through this was, and I was explaining to one of the residents here outside, that it was a very wet summer, and as we delineated the wetlands, the impacts for our proposed alternative were more substantial than our conceptual design had anticipated. So we had to regroup a little and revise the design to bring the berm and bring the proposed fence closer to the highway to minimize wetland impacts and make it permittable. We had some other infrastructure along the highway that we need to install, some guardrail because the fence is now closer to the highway. But that is all moving forward. I recognize it has taken more time, and I recognize the frustration We did have a very successful meeting with the natural resource agencies in just before Christmas. So I'm confident that it will be done this spring. Hopefully, hopefully April, we'll get more detail as the permitting and stuff goes forward and stuff. But we are committed to building that berm and fence there. And I guess I'll just leave it at that if there are any questions for the committee.
I have one. Do you have a cost on the berm and the fence?
Yes, our current estimate, if, and part of the evaluation that we did when we looked at the cost of installing a sound wall, it's going to be about $3.6 million. The current cost of the berm and the fence and the guardrail associated with it is about $650,000. So it's not inconsequential, but it is. We feel it's reasonable that we can do that. But
And where's that funding coming from? Is that
it's part of the. It's going to be part of the Turnpike capital expansion.
okay?
It's going to be part of the project cost. I should have said there is an ongoing construction project on the Effie Everett Turnpike right in that location.
Any Senator Warren?
What kind of a structure would do the job?
What kind of
What kind of a noise barrier? You said it's too expensive because there are not enough
Right.
people living in the area. So obviously, if there were enough people, you would build something. So what does that kind of structure look like?
Our typical standard sound wall is concrete pilasters, and we have switched from wood panels to precast concrete panels now. So if you drive through Manchester or along 93, where you see sound walls, that is our standard that we build. Senator, you're from Dover. You see the ones around the Spalding Turnpike and in that area. So they're, I forget the dimensions, but they're drilled foundations with a concrete pilaster that the slotted panels fit into, and they're dense enough and thick enough. John can provide the decibel things here, but it needs to be beefy enough to have that noise mitigation.
But I've seen some of them with, looks like big grass growing in and sort of filling out the walls. Instead of a gray wall, you have a natural looking cement wall. Do they all have the plants?
No, they don't. No, and I think the tray walls that you may be referencing, there's one in Nashua, there's one in Manchester.
Right.
They've proven to be very ineffective because the soil dries out, the material doesn't keep growing, and you end up with gaps in
Okay.
between.
So a solid cement wall will be the choice.
Yes.
Okay, thank you.
Senator Larson, that's a good question. So, Commissioner Katz, it's good to see you.
Good to see you.
So, you said even with the berm and the plants that have been delayed, that it's not going to help mitigate this noise. And you agreed that the noise does exceed and fall within your policy guidelines. So what the bottom line is that you're telling me the way the policy is, people who own their homes, even though the noise is unbearable, the density is the problem. So how wouldn't that make sense to have a policy change?
More money.
With a policy change like that comes a cost. So we tried to establish our policy that was that provides a reasonable balance between cost and benefits to the adjacent property owners. So and John can speak if you want some of the details, but I equate it to if there's like a single property and it costs $100,000 to build a wall to protect that property, based on our criteria, that's not a reasonable expenditure. If there are 4 properties and that same $100,000 wall, or maybe it's a $125,000 wall, not real numbers, but just as an illustrative example, if that same cost benefits, four receptors or four properties, that's more reasonable, that's more cost effective. And that's essentially the principle that we have, established in the second part of that criteria of our noise mitigation policy of setting some threshold of cost reasonableness. And I think historically, when this bill has come up in the Senate in the past, when we've done comparisons to other states, I think New Hampshire falls right pretty much in the middle of our policy compared to other states. Some states are much more lenient and are more readily apt to build sound walls. Others are more restrictive, and it's nearly impossible to meet those criteria. So that is a policy decision. Like I said, I think there are areas like T-Berry Lane that certainly are impacted, but I think, what we have established has served us, reasonably well.
Thank you. There's always an exception to the rule. I think what's bothering me the most, truthfully, is that if these were not individual owned homes and it was an apartment, you would spend the money to do it. And the apartment is renters that will move and have no stake or stock or value in where they live. And I just find that bothersome.
John, do you want to speak about how you evaluate an apartment building versus condominiums, or what we?
Sure. So I think what might help you a little bit is to understand that it's not so much about the impacts as the benefit, the amount of, or the effectiveness of the wall itself. We're trying to identify where there's benefits and how many benefits we're getting from the barrier. Not I'll kind of try and briefly give you a summary of what our noise policy includes. And basically the first thing we would do is identify where there's noise impacts. And again, we've acknowledged that there's noise impacts here. There's noise impacts at many neighborhoods throughout the state that I will get concerns expressed similar to T-Berry Lane. But when it comes down to determining whether a sound wall can be put in, we need to look at, okay, can we build it? And in most cases, yes. And then the next step is to determine whether or not it's reasonable and we can provide an effective noise barrier, because it's possible too, if you completely eliminate the ability to determine whether or not it's effective, you could be putting in barriers that don't do anything, because there are certain circumstances where a noise barrier just couldn't do anything because of the way the topography is or something like that. So in this case here, it's really about the number of the amount, the effectiveness of that wall. And in certain circumstances, yes, where you have say an apartment building, it's going to be more effective. It's going to provide more benefits to more families and more people, and that's kind of the goal, is to try and find where that effectiveness is. And in this case here, it's 1,500 square feet of wall per benefited household. And a benefit is somebody who receives a noticeable noise reduction that is 5 decibels. These things also, I should add, they don't eliminate the noise. They reduce the noise. So that's another key
So
piece.
the apartment benefits more people because more people live in an apartment than the neighborhood that bought their home. Is that correct?
So the wall would provide more benefit to if there were an apartment building behind it. Yes.
Thank you for the answer.
More benefit to more people.
Yes.
Yeah.
Any other questions?
Oh, please.
I have one more, because you mentioned the berm and the environmental permits. In the impact statement here, you mentioned that whether or not you'd get NHDES or the Army Corps to approve the environmental impacts on the wetlands if it were a wall. But given the progress you made in the berm, is the walls would have additional wetland issues beyond what the berm has had?
Potentially. We didn't have the level of detail in evaluating the wall, but typically, the berm required for a wall would have a bigger footprint and a larger, physical impact.
Okay, thank you. Anybody who didn't sign up who wants to speak? Oh, please come forward and identify yourself.
Thank you, Commissioner.
I don't have a pen, could you? What's his name,
Oh, yeah.
whoever it is coming up? And you can take over if you want.
Oh, you can finish this one.
Right, whatever.
My name is Tracy Treadwell.
Okay, could you state your name again for me?
Sure. Tracy Treadwell. I live on County Road, which intersects T-Berry. I lived there 30 years. Summer times, some years ago was the noise wasn't too bad. At this point, year round, it's really difficult to carry on conversations outside. If you have somebody with a lawnmower driving next to you in your yard, you wait till they go by to continue the conversation. In this situation, you can't wait for them to go by because the noise is just about 20 hours a day. You get your 6 to 8 in the morning, the folks going to work, noontime running around for people going back and forth, and then from 5 to 8, you get to hear it again. You're trying to go out and sit at a picnic table in your backyard to have dinner, and you have to raise your voice to talk to family members because of the noise of the road. A couple of years ago, there was a lot more material between where I live and the highway. They blasted a lot of material out of there to work on the Everett Turnpike. And that obviously, without any structures in the way, it's another couple hundred yards of open highway that we get to enjoy. Headlights coming into the house, car accidents, people leaving the highway, either because their car broke down or because they look and, we can walk out here or we can drive out on the county road, which you can't. Some of the GPS systems still show that as a through road. We have 18-wheelers coming down there a lot to try to get on the highway because they don't realize that you can't get there. And they back up. That stuff happens, understand that. But the noise and the ability to be safe in your house is compromised. There are a number of neighbors that have had things stolen from the yards, from folks that come off the highway, people that decide that this is a good place to use as a bathroom. Happens pretty frequently. I've got grandkids, and I brought my family up there, and it wasn't such a concern because there was sufficient brush and trees in the way. That's not there anymore. Car accidents, we've had a couple this year already, not January, in the fall, that have come off the highway into the land, into the property, into people's properties. That's pretty difficult to try and understand or to deal with. If there was something there, and this berm may make it better, but I don't believe that fence is going to have a huge impact on the decibel level. When it's the middle of summer, trees are in full bloom and whatnot. 70 decibel reading in somebody's yard is not heard of. 70 decibel reading in neighbors' yards is heard of a lot. This time of year, when there's nothing nothing to suppress the noise, hasn't been measured. But I know that it's a lot louder because I live there. I wish that if the the prospective fence that's going up there is, according to Mr. Cass, is not going to fix the problem. $650,000. I think there should be, why spend that if it's not gonna fix it? There's a number of other neighbors that you talk to as you walk up and down the road. They're fed up. It's been 12 years since this started. It's moved out, and now we can fix it, but it's not gonna work really well. I don't think that's an acceptable answer. If you want to be able to go on your property, you should be able to enjoy that property and not listen to trucks that are jake braking, car accidents, and everything else that a highway puts out there, shall we say, for noise. I don't know what the actual answer would be. I wish I did. But if this isn't going to help, then I think we should move farther ahead. There's more than 10 people in the area that have complained and that speak about the noise levels. They're not here. Tried to get them here, but because it has been so long, what difference is it going to make? And that's the feeling that I get from a number of my neighbors. If it's not going to help, why should I do it? And putting this up just shows me that it's not going to help, but this is something we can do. Don't know. I would rather have something that's going to reduce the noise a heck of a lot more. That's all I had to say.
And Ruth, do you have a question? Any questions? Thank you for your testimony. Thank you and Mr. Dutton for coming and representing the neighborhood.
You're welcome.
I'm trying.
I understand that. Thank you very much for your help.
And I think that's everybody who wants to speak, so I will close the hearing.
Okay.
I'm up.
Oh, you're up now. We're just taking turns today.
I know. Musical chair.
Okay. Where are we here? It's 470, right? Okay, we'll open the hearing with Senator Waters on Senate Bill 470.
Chair, I'd rather help the staff.
You need this?
Yeah.
Oh, you want this for all of us?
Yeah.
Okay.
There was a drafting error.
Oh.
Yeah, it's 62S.
Okay. Oh, thank you.
I think maybe some of us have it already, but there you are.
Okay.
So thank you, Madam Chair. I'm Senator David Waters, District 4, here to introduce Senate Bill 470 relative to allowing toll-free use of vehicles registered with municipal plates. And this bill puts in statute what we've already been doing, that we have been providing toll-free for municipalities. And what this will do is give that exemption in statute to motor vehicles bearing plates registered to a New Hampshire municipality. I did not catch an incorrect citation of statute, so as you'll see in the amendment, it should read RSA 3237:12 on line 1. And the way this will work is that DOT will require the municipalities to get a non-revenue transponder, kind of like what we have, and the municipality will pay the $6.50 for that transponder, and then it will be in statute and legal to do what we've been doing already. And I think we can all see I won't argue about the logic of having this be a group of folks that ought to have this program for them. So thank you, Madam Chair.
Thank you. Any questions? Seeing none?
Thank
you
you.
very much. Well, Chair will now call Commissioner Cass again. Welcome back.
Thank you, Senator and committee members. For the record, again, William Cass, Commissioner of the Department of Transportation. So, appreciate Senator Waters sponsoring the bill for the department. And the purpose of this bill, as he said, is to correct an issue that has arisen with municipal plates using the turnpike system. Historically, all municipal plates were provided toll-free passage on the New Hampshire Turnpike system. It was recently, in the last few years, come to our attention from a number of municipalities that they're not being issued specific municipal plates anymore. They're being issued regular passenger plates, so which do not, at least under the current law, qualify for toll-free passage. So this bill then changes it to this bill just changes the law to talk about any municipally owned vehicle. And with that, we will implement it by issuing the orange non-revenue transponders to those municipalities to use in those municipal-owned vehicles for toll-free passage at the turnpike system. So,
Okay. Questions? Seeing none, thank you.
okay, thank you.
Are there any members of the public that would like to speak to Senate Bill 470? Seeing none, we will now close the hearing on Senate Bill 470. I'll go to the next bill, it's behind. Right? We're now going to open the hearing for Senate Bill 471.
Thank you, Madam Chair. Senator David Waters, District 4, introducing Senate Bill 471 relative to adding a speed limit of 45 miles per hour on rural highways. And like the last bill, this is a request of the department. And if you look at the bill, really the simplest way of seeing the bill is that bold on page 1 on lines 20, where we're adding a 45 mile per hour zone for unimproved rural highways as defined in RSA 259-116. And just a little bit of a background, New Hampshire traditionally has, in terms of its speed limit and types of road, has followed the Uniform Vehicle codes. And that's what we have. And it has a kind of a legacy of a pretty sharp distinction between urban, suburban, and all other locations. And so in a way, back in the day, when you get off the beaten track, it would go up to 55 miles an hour because they're less inhabited areas. But a lot of times those roads, because of the way they're laid out a long time ago, or whether or not they have full breakdown lanes, or whether they have rocks or boulders. I'm thinking about Route 9 in Barrington. All of a sudden, you're thrown into these areas where the trees and the boulders and stone walls are right there. And so it does seem to make sense for 55 in these rural areas that are engineered for it. But a lot of the other roads are just simply not appropriate for it. So what this would let the department do is to designate some roads as 45 mile instead of 55 mile. Now, why is this going to make a difference? I can speak kind of personally to it, which I hadn't really thought about until I, saw the bill here. Route 4 in Rollinsford goes from Dover over to South Berwick, and it had a 55 mile an hour limit. And what's happened over the years is that there used to be couple farms, but more and more driveways, more house lots, more people pulling out onto this road. And there's a couple of tricky visibility points where there's a road that comes up out of a farm. You used to have nobody live there, but now there's a lot of people living down there. In the last few years, there have been a couple of just horrific crashes. A newlywed couple killed, family. And so we came forward with Rollinsford and said, we want to reduce the speed limit down here to 50. And it was really complicated to do because the statute says the way that road is defined is a 55 mile. So we had the special hearings, all kinds of things. We finally got it down to 50 miles. And during that time where that debate was going on, another fatality. So I think this is, just changing circumstances in New Hampshire. This 45 mile limit, I think is going to save some lives and really accounts for the changing populations and road use in the state. I know that Commissioner Cass is here to provide some more background about how the department will use this new designation, but that's the bill. Thank you, Madam Chair.
I have a question for you, Senator Waters.
Yeah.
First, a comment. I have gotten complaints from constituents in rural areas about the speed being too high and a lot of these problems. But my question is, if you're changing it in statute so that you're able to do it easily, but you necessarily will. In other words, what if you have a town who they don't really want it changed? How is that going to work?
Well, thanks for the question. I'm sure Commissioner Cass, but I can talk about it. I think the issue is here, what's going to be reasonable? And, auto fatalities nationwide, and it has something to do with COVID, it has something to do with the cell phones, but we are seeing more, and we're seeing more and more vehicle miles traveled on our roads. So I think there's a way to reasonably deal with municipalities' wants. What I was worried about is the municipality may have a want, and as I said, the accidents may have occurred, but it was very difficult because of existing statute to just say, oh yeah, we can do that, we can redesignate it. So
That makes sense.
yeah.
Thank you. The chair will now call Bill Lambert.
Oh, I didn't see what you, Bill. Yeah.
Important bill.
Good afternoon.
Bill squared.
Thank you.
Good afternoon. For the record, my name is Bill Lambert. I am currently the Highway Safety Active Transportation Administrator for the Department of Transportation. Prior to that, I spent 23 years as a state traffic engineer, and in that time, I spent 10 years as the person with the Commissioner's designated authority to determine state speed zones on state highways. So speed limits is something I've dealt with a whole lot. I handed out written testimony signed by the Commissioner, and I won't reread that for you. Just to go over some of the bullet points. First of all, I think in general, there's a misconception of how speed limits are determined. I think people think that speed limits are determined by the Commissioner of Transportation delegated to staff or by towns and cities. And realistically, by law, I'm not a lawyer, but the way I interpret it, speed limits are set by you folks. The general court determines by the statutes what the speed limit is. The Commissioner has the authority to vary from that speed limit on state highways. Towns and cities have the ability to vary from that speed limit in their own jurisdiction, but always based on an engineering and traffic investigation. And that's what Senator Waters was referring to, is that the engineering and traffic investigation, which includes a speed study, a measure of the current speed distribution on the road, and ideally that speed limit would be set at 85th percentile, so that enforcement can focus their attention on the 15% that aren't following this posted speed limit. When we get complaints about speed, almost always the engineering and traffic investigation or the speed study does not support lowering the speed limit. So you have to look at some other criteria. And I've always felt when we've met with communities, we've had people complain about speed. It seems odd that the legislative statutory speed limits would have that gap from 35 miles an hour for a rural residential district, which is a fairly suburban density, to 55 for all other locations. And other locations of 55 miles an hour, if you're on a engineered, constructed highway with wide shoulders, flat curves, moderate grades, and the roadside vegetation and hazards are cut way back, 55 is pretty reasonable. 55 is Spalding Turnpike through Dover. But 55 is also the statutory speed limit for any of the numbered state highways. And if you don't meet that density for residential, rural residential development of 35, the statutory speed limit is 55. And in the 10 years that I was doing the speed limits for the state, I felt that it was important to go with the statutory speed limit, and anything different from that should be the exception, not the rule. So having that intermediate 45 is a tool, so when we have some of these unimproved highways, and the definition that we came up with was rural or unimproved rural highways, and we've got that defined in a different statute. those locations would have the statutory value of 45 miles an hour, which would be the legislative intent. And then varying from that would be based on an engineering and traffic investigation. I think it's important to note that this change doesn't necessarily mean that the speed limit would be reduced. Some places it might actually be increased. That there's places over the years, and I inherited a legacy network of speed limits in 2013 that included a lot of what I would consider questionable practice, places that were arbitrarily reduced to 35 miles an hour because that was a desired value. And then when we come back 20, 30 years later, we're still getting complaints about speed, and we're finding that people aren't going anywhere near that. As an example, in Wakefield, New Hampshire on 153, it follows Route 16, parallels Route 16, but it kind of snakes along through some lake villages. The police chief had a hard time enforcing the posted 35 that was posted 35 because of the windy nature of the road. Because if people were doing 45 and he pulled them over, that was the prevailing speed and what he thought was reasonable and safe. But if you pulled them over at 60, which he thought was speeding, now it's a 25 over and it was must appear in court and a stiffer penalty. So working with the chief, we changed the speed limit based on engineering and traffic investigations to 45. As a result of that, we went back and looked at all the curves on that winding road that we lowered the speed limit to address, and we added 200 separate new curve warning assets. So in some cases, some of our legacy systems, speed limits that have been reduced arbitrarily may actually go increase to 45 based on this statute. But for the most part, we're looking at those unimproved roads that are following rivers, winding around hills and farms, and with no shoulders and poor sight distance, and rocks and boulders and trees that are right next to the pavement. Another example, I think Rollinsford was a great example, and since my son owns a condo in Rollinsford, and Bill grew up in Rollinsford, I think we're pretty familiar with it. But the commissioner and I have been dealing with folks in Sunapee and New London on the stretch of Route 11 between Sunapee and New London, including George's Mills, and again, posted 55 because there's not a lot of access points along that road. It doesn't meet the rural residential. But every time we've done a speed study, it doesn't support the reduction that's being requested. This would give us an opportunity to use the legislative intent of 45 to lower the speed limit without the requirement of engineering and traffic investigation. So an engineering and traffic investigation, in the last 10 years, when the speed limit setting went from our district offices to the traffic office, it was a lot more formalized. What we do now is we do the speed study, we look at the character of the road, we look at traffic volumes and crash history. We also use an expert system from Federal Highway. So when we do an engineering and traffic investigation, it's pretty robust. And I'm confident that when we need to look at varying from the statutory speed limits, we have a process in place to do that. I'm just looking to create the legislative intent for this intermediate speed limit to make the roads safer when they're not built and engineered for 55-mile-an-hour traffic. And there was a question earlier about what would happen if a town didn't want to change. I'm not a masochist. Anytime I change the speed limit in a town, I'm going to want to make sure I have local support for it. There's places where we've done engineering and traffic investigations that have supported a change up or down, but we present that change to the towns, and if it's not supported, we move on, because there's other places that we can have some success. So if a town didn't support the change, we wouldn't go forward with that change. So it's always while the commissioner has the legislative authority to determine state speed zones, we'd be foolish to try to do that without the local support. And with that, I'd be happy to answer any questions.
Members of the committee have any questions?
So how many areas are going
Can you turn your mic on, please? Thank you.
How many areas are going to be changed? There are now 55 that you
It's
going to go down.
I
to
was just
45.
saying, it's addressed in the letter. It's not our intent to do a full statewide reevaluation of the speed limits. This would be kind of going forward to address these issues, or new projects, or when speed-related issues come up. It gives us another tool to address it. But it wasn't our intent to, kind of go back and revisit all the
Okay.
all the
That's all I need
roads
to
and
know.
postage. Right.
Thanks.
You're welcome.
It sounds to me like passing this bill is just going to create more efficiency for your department.
I should put that in my notes. Yeah,
Good
that's
luck.
right. Thank you.
Well, thank you for your testimony.
Thank you.
Are there any members of the public that would like to come speak to Senate Bill 471? Seeing none, I will close the hearing on Senate Bill 471. What exactly I have to do? Oh, there it is. Why is it? What am I missing on this sheet here?
We've got,
I know, but look.
on the back, 465. It's the,
Yeah, look, it's not on my,
motorist duties.
it's not on my, this.
Could, and, could,
Oh.
could the rest of us get one of those when we come in the room? No. It's all right, I don't need it now, but I just didn't know if I was gonna miss one.
Okay, we will now open the hearing on Senate Bill 465. Welcome, Senator Fenton.
Thank you for having me. Save the best for last, right?
We'll see.
Thank you, Madam Chair and members of the committee. I am Senator Donovan Fenton. For the record, I represent District 10. Here to talk to you about Senate Bill 465 relative to motorist duties when approaching highway emergencies involving a disabled vehicle. The current move over law in New Hampshire applies to vehicles displaying red, blue, amber, emergency, or warning lights, but Senate Bill 465 will expand this law to cover all disabled vehicles as well. This bill calls for action for motorists when approaching a disabled vehicle along the roadside. It also adds the term disabled vehicle and provides a definition. And we also have an amendment, which I think was passed out. There we go, right on time, where we just forgot to add disabled vehicle into section or line 6. Currently, 20 states have similar model laws. And this bill would require vehicles to, with all due consideration to safety and traffic conditions, to move over safely. If impossible or unsafe, vehicle operators may pass a disabled vehicle at a careful speed. And the intent of this bill will not only help clarify confusion surrounding current move over laws, but also take an important step in creating a clear standard for passing stationary vehicles that are either working or appear to be disabled. And with that, I'll take any questions.
Members of the committee?
I'm good.
Senator Waters?
Thanks. I should have checked on this, but the definition of disabled vehicle. If somebody had just pulled over, is that a disabled vehicle? And they don't have their flashing lights on, they're just there on the side of the road.
I see some guys with badges behind me. I think they
All
may
right,
be
all
able
right.
to describe it a
Not
little
that it
better.
makes a lot of difference to me, but I'm just curious about.
The way I understand disabled vehicle is it's a vehicle on the side of the road that may not have an occupant or is not working, things like that. You know, I think it's really, I think it's a
That's fine,
broad
that's fine.
definition of, you know, a dangerous vehicle on the side of the road. Thank you for the question.
Thank you for the testimony.
Thank you very
All
much.
set. Thank you.
Chair will now call Bill Lambert. Welcome back.
Thank you. Thank you, Madam Chair, members of the committee. For the record, my name is Bill Lambert, New Hampshire DOT Highway Safety and Active Transportation Administrator. I think I'm on the list next because I was here earlier and signed before others with badges. Department of Transportation would support this bill just because it's logical that if we're going to ask people to have the common sense to move over when there's lights on the side of the road, that I don't think we need any more than the recent accident in Sanborn when a young man lost his life late on a Friday night, maybe Saturday night, when somebody hit their vehicle while they were standing outside of it. It just makes sense. I think there was another fatal crash in Charlestown not too long ago when some young people were standing outside their vehicle after they hit a bear and they got hit by somebody. It's just common sense. You shouldn't need to legislate it, but if we're going to protect the people with red, blue, and amber lights, we should protect the people that are for other reasons on the side of the road. And I'd be happy to take any questions.
Members of the committee, I have a comment. That person was trying to change their tire, So I agree with this wholeheartedly. My question is, even when we had the move over law with all the lights, a lot of people still were not really aware. How do you propose in this bill passing that it's gonna be clear that you have to move over no matter what?
Good question. Thank you for the question. The move over law is a rule of the road, and typically from a sign perspective, you don't sign for rules of the road, but certainly you need to make sure that drivers are aware of that. So part of that's driver education, and I think there's people behind me that can speak to that. We do promote the move over law with our changeable message signs as part of our, I guess, our routine traffic safety messaging. We do have some select locations, entrances to the state where we put in the move over law. It's hard to put what's in that statute on a sign, so there are other effective means to message that, and I think it's whatever we can do to promote that, we would try to do. And Department of Transportation, as we have with the move over law in the past, would work with our partners in the Department of Safety to come up with a way to do that.
Okay, thank you very much.
Thank you.
Okay. The chair will call. Hold on. I can't see that even with my glasses. Help me out.
Lieutenant Storm.
Okay. Next time for me, big font.
The guy with the badge.
Good afternoon.
Good afternoon.
I'm obviously Lieutenant Chris Storm. I am currently with the Department of Safety Division of State Police. I am the Special Services Commander, but I'm also right now currently the liaison for the Office of Highway Safety through the State Police. So basically what Mr. Lambert said was exactly how the State Police feels that. To answer Senator Waters' question, I just looked to see if there is an actual definition in under 259. I did not see one for disabled vehicle, so that's something we may have to look into. There could be something as far as hazard lights or something that we can put as far as four-way, maybe as a possible amendment as a suggestion for that. Anecdotally, I would bring up the same things that Mr. Lambert brought up as far as that recent collision on I-93 with that, exactly what you said, Senator, that gentleman that was out changing his tire and was hit and no one moved over for him. We see that every day out there on the interstate system. We see that on our local highways and byways that all these people are failing to move over. And we just feel like it's not just the folks that are having blue lights are out there working, but it's everybody. It could be anybody. It could be any one of our families. It could be anybody that's actually out there. So we would just hope that everybody would move over for any individual, and then give us a way to just stop and maybe, and to your point, Senator, start with some education as far as that goes. We can also get that out messaging through numerous different avenues through the Department of Safety and also through the Office of Highway Safety to try to get some of that messaging out there. As Mr. Lambert said, it's very hard to put all of that verbiage of that RSA onto one PSA. So we'll do our best to get that out there.
Thank you. Questions? Senator Waters?
Thank you. And I don't mean to be niggling about it, but it would be interesting to have some of your guidance, I think, on that, the word disabled there for vehicle, because I'm just thinking, disabled vehicle, we have certain assumptions about that. They might not have their flashes on, they might not, but it's disabled vehicle. But there are times people just park.
Correct.
And I kind of think that if cars are parked, then if you can safely, as the statute already says, you can pull over a little bit. So I just don't know whether it's a distinction. Maybe it could just say vehicle, but that's for you all to offer advice on.
Yeah, absolutely. And we can certainly work with Senator Fenton to find the proper verbiage for that.
I mean, it's good for people to pull over.
Yes, and we can talk about the different, classifications of roadway where people have to move over and which class roadway, so forth. I understand what you're saying.
I don't want to make it overly complicated, but you see what I'm saying.
I do.
Yeah. Thank you.
Thank you.
Thank you, Madam Chair.
Good point.
Maybe.
Okay.
Good point.
Thank you. Okay, the chair will call Dan Goodman from AAA, who I bet would help with the messaging.
All right, for the record, my name is Dan Goodman. I'm the Public Affairs Manager for AAA Northern New England. And thank you very much, Madam Chair, for having me and other members of the committee. I don't want to repeat what Bill and Lieutenant Storm said. Those are all points that are super valid and many reasons why we should be passing this bill. It will make New Hampshire roads safer. The intent is that we want motorists to not think about what color light it is or what type of vehicle on the side of the road, that it's a person. To reduce that confusion and just move over if you can and slow down. We think this will reduce crashes, reduce fatalities, and make New Hampshire roads safer. In terms of the messaging, last year, a year and a half ago, we made a slow down, move over PSA. We partnered with Department of Safety and Greenland Police Department, DOT, a fantastic 30-second PSA that aired throughout New Hampshire. And I've been thinking over the last couple days on how the messaging could change if this law was passed. Because I know we've seen on the variable message boards when we go down the road, move over for, and it lists all the color lights. And that's confusing. We know from a AAA study about a quarter of respondents said that they didn't understand their slow down, move over law, or they didn't know it was a law. So I think if we can simplify the law, that more people would adhere to it. So one of the things that when we were just talking about the State's Traffic Safety Commission, we were talking about this piece, and the first thing that came over is I was envisioning slow down, move over for all.
That's good.
Just something very simple. Everyone knows we slow down, move over for all motorists. Let's make New Hampshire a safer place for everyone, no matter if you are an EMT on the side of the road or you're Senator Waters changing his tire. This is let's all the same protections. Hopefully you have AAA, and then we'll be there for you. So I think that's all I have to say. I think this is a common sense and a very, very good bill.
Thank
And
you.
with that, I'd be happy to answer any questions.
Any questions? Thank you for your testimony.
And if you don't mind, I forgot there was one thing I wanted to add. I think it's just as I was I was signing in, I thought it was a very impressive list of people, of organizations throughout the state, from tow and law enforcement and the auto dealers and the chiefs of police who are all supporting this bill. So with
I
that,
was just
thank
going
you.
to comment on that because I wanted to say there was absolutely no opposition and a lot of support.
That's great.
Thank you.
Thank you.
Are there any members from the public that would like to speak on this bill? Seeing none, we will now close the hearing on Bill 465. Thank you. If you're all in agreement, I'd like to go into executive session.
I move executive session.
Okay. May I have a motion on Senate Bill 470? All in favor of Senate Bill 470 ought to pass?
Aye.
Aye. Senator Waters, would you like to take that out?
I will take that out.
Could I have a motion for consent?
Move consent.
Second.
All those in favor of 470 going on consent?
Aye.
Please.
Aye.
Aye. Okay. May I have a motion, please, for Senate Bill 471?
Move up to pass,
Second.
and I will move amendment, what's the number?
Oh,
Is that the only amendment on?
it's
Which
in
is the one we had the amendment?
this.
Oh, jeez, I'm sorry, Madam
We have
Chair,
to fix
may I
that.
move, I reconsider our motion on Senate Bill 470?
So moved.
So you seconded and,
Yeah.
so all in favor to reconsider, I guess?
All in favor of reconsideration on Senate Bill 470, please say aye.
Aye.
Okay.
I'll move up to pass on Senate Bill 470,
Second.
and I'll move the amendment.
Second.
Second, yeah.
All those in favor?
Aye.
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 I'll move up to pass as amended.
Okay.
Second.
All those in favor?
Aye.
And you'll take it out on,
I'll move consent.
and move consent. Second.
Second.
All those in favor of consent, please say aye.
Aye.
Aye. Okay.
In the terms of the first bill, and I messed it up.
You're a little rusty.
It's been a long couple of days.
I don't know.
let's
This
see.
does not augur well.
Okay. We'll try again now to seek a motion on Senate Bill 471.
I'll move up to pass.
Second.
Okay, all those in favor of ought to pass on Senate Bill 471?
Aye.
Aye.
Second.
All those in favor of 471 on consent?
Aye.
Aye. Senator Waters, do you
I'd
want?
be happy to.
Okay.
Thank you.
Okay. Now, on Senate Bill 465, do we need to wait to get that definition clear, or can we pass the bill? Thoughts?
Well, my only thought is, we may not want to use the word disabled because what if I'm on the side of the road with my kids and they have to go pee? The car's not disabled per se, but we want to move over for any vehicle.
So we should wait and get that
Yeah,
corrected.
I think we're not in a rush to.
All right.
Yeah, I think we wait, get the right language.
I wanted
and we
to
can move
get your
forward.
opinion.
Yeah.
Okay, is there anything else before I go out of executive session? Okay, I'm going to close the hearing on the executive session,
Good.
and I need a motion to adjourn for the day.
So moved?
Okay, transportation today is now adjourned.
Good job, Madam Chair.
Okay.
Yes, we're cruising. So, Denise, on the, 428,
Yeah.